Are you looking for effective biological therapies to treat atopic dermatitis? Look no further as we compare two popular options, Dupixent and Eucrisa. Atopic dermatitis, also known as eczema, is a chronic inflammatory skin condition that affects millions worldwide. Managing its symptoms can be challenging, but these breakthrough treatments offer hope for sufferers. Overview of Dupixent and Eucrisa as biological therapies. Dupixent and Eucrisa are two innovative biological therapies that have revolutionized the treatment of atopic dermatitis. While they work in different ways, both have shown significant efficacy and safety in clinical trials. Dupixent is a biologic medication that targets specific proteins in the immune system that are believed to contribute to the development of atopic dermatitis. It is administered through subcutaneous injections and works by inhibiting the signaling of two key proteins, interleukin-4 and interleukin-13, which play a crucial role in the inflammatory response associated with atopic dermatitis. On the other hand, Eucrisa is a topical ointment that is applied directly to the affected areas of the skin. It contains the active ingredient crisaborole, which acts as a phosphodiesterase 4, PDE4, inhibitor. By inhibiting PDE4, Eucrisa reduces inflammation and controls itching, providing relief to individuals with atopic dermatitis. How Dupixent works in treating atopic dermatitis. Dupixent's mechanism of action sets it apart from traditional treatments for atopic dermatitis. By targeting specific proteins in the immune system, Dupixent aims to disrupt the inflammatory cascade that leads to the characteristic symptoms of the condition. Interleukin-4 and interleukin-13 are cytokines that are involved in the immune response and contribute to the development and maintenance of atopic dermatitis. Dupixent blocks the signaling of these proteins, thereby reducing inflammation and improving the overall condition of the skin. In clinical trials, Dupixent has demonstrated impressive efficacy in treating atopic dermatitis. Patients who received Dupixent experienced significant improvements in their symptoms, including a reduction in itching, redness, and the severity of their skin lesions. Moreover, Dupixent was found to improve patients' quality of life, with many reporting a decrease in the impact of atopic dermatitis on their daily activities and sleep patterns. However, it is important to note that Dupixent is not a cure for atopic dermatitis. It provides relief from symptoms and helps manage the condition, but long-term treatment may be necessary to maintain the benefits. How Eucrisa works in treating atopic dermatitis. Unlike Dupixent, which is administered systemically, Eucrisa is a topical ointment that is applied directly to the affected areas of the skin. This localized treatment approach makes it a convenient option for individuals with mild to moderate atopic dermatitis. Eucrisa contains crisaborole, a non-steroidal phosphodiesterase 4, PDE4, inhibitor. PDE4 is an enzyme that plays a role in the inflammatory response, and by inhibiting its activity, Eucrisa helps to reduce inflammation and alleviate symptoms such as itching and redness. Clinical trials have shown that Eucrisa is an effective treatment for atopic dermatitis. Patients who used Eucrisa experienced significant improvements in itching, redness, and overall disease severity compared to those who received a placebo. Eucrisa's localized application also minimizes the risk of systemic side effects associated with other treatment options. While Eucrisa is generally well tolerated, it may cause a burning or stinging sensation upon application. This side effect is usually mild and temporary, but if it persists or worsens, it is important to consult a healthcare professional. Efficacy and safety of Dupixent in clinical trials. Dupixent has undergone rigorous clinical trials to assess its efficacy and safety in the treatment of atopic dermatitis. The results have been promising, with many patients experiencing significant improvements in their symptoms. In a pivotal Phase 3 clinical trial, Dupixent was evaluated in over 700 patients with moderate to severe atopic dermatitis who had not responded adequately to topical treatments. The study found that Dupixent significantly reduced the severity of the disease compared to a placebo. Patients treated with Dupixent also reported a reduction in itching and improvements in their quality of life. Another Phase 3 trial focused on the long-term efficacy and safety of Dupixent. The study followed patients who received Dupixent for up to 52 weeks and found that the benefits were sustained over time. Moreover, Dupixent was generally well tolerated, with the most common side effects being injection site reactions, conjunctivitis, and cold sores. Efficacy and safety of Eucrisa in clinical trials. Eucrisa has also undergone extensive clinical trials to evaluate its efficacy and safety in the treatment of atopic dermatitis. The results have demonstrated its effectiveness in reducing symptoms and improving the overall condition of the skin. In a pivotal Phase 3 trial, Eucrisa was evaluated in over 1,500 patients with mild to moderate atopic dermatitis. The study found that Eucrisa significantly improved disease severity compared to a placebo, with a greater proportion of patients achieving clear or almost clear skin. Eucrisa also demonstrated a rapid onset of action, with improvements observed as early as the first week of treatment. Long-term studies have shown that Eucrisa maintains its efficacy over time. Patients who continued using Eucrisa for up to 1 year experienced sustained improvements in their symptoms and quality of life. The safety profile of Eucrisa is generally favorable, with the most common side effect being application site pain or burning. Comparing the effectiveness of Dupixent and Eucrisa in treating atopic dermatitis. Both Dupixent and Eucrisa have proven to be effective treatments for atopic dermatitis, but their mechanisms of action and administration methods differ significantly. Dupixent targets specific proteins in the immune system, while Eucrisa acts locally to reduce inflammation. The choice between the two depends on various factors, including the severity of the condition and individual patient preferences. For individuals with moderate to severe atopic dermatitis, Dupixent may be the preferred option. Its systemic approach provides comprehensive relief from symptoms and has shown sustained efficacy over long-term use. However, Dupixent requires subcutaneous injections, which may be a drawback for some patients. On the other hand, Eucrisa is a suitable choice for individuals with mild to moderate atopic dermatitis. Its localized application minimizes systemic side effects, making it a safe option for long-term use. Eucrisa is convenient to use and does not require injections, which may be preferred by patients who are hesitant about injections. Ultimately, the decision between Dupixent and Eucrisa should be made in consultation with a healthcare professional. They can assess the individual's condition, medical history, and treatment goals to determine the most appropriate option. Side effects and precautions of Dupixent and Eucrisa. Like any medication, both Dupixent and Eucrisa carry the risk of side effects. It is essential to be aware of these potential adverse effects and take necessary precautions when using these treatments. Common side effects of Dupixent include injection site reactions, conjunctivitis, and cold sores. While these side effects are generally mild and temporary, it is important to inform a healthcare professional if they persist or worsen. Additionally, Dupixent may increase the risk of developing eye infections, so individuals with a history of eye problems should exercise caution and seek medical advice if necessary. Eucrisa is generally well tolerated, with the most common side effect being application site pain or burning. This side effect is usually mild and temporary, but if it becomes severe or persists, medical attention should be sought. Eucrisa should not be used in individuals with known hypersensitivity to crisaborole or its components. As with any medication, it is crucial to follow the prescribed dosage and instructions provided by a healthcare professional. Regular checkups and monitoring may be necessary to ensure the treatment is effective and well tolerated. Choosing between Dupixent and Eucrisa for atopic dermatitis treatment. When considering the choice between Dupixent and Eucrisa for the treatment of atopic dermatitis, several factors should be taken into account. These include the severity of the condition, the individual's treatment goals, preferences, and medical history. For individuals with moderate to severe atopic dermatitis who have not responded adequately to topical treatments, Dupixent may be a suitable option. Its systemic approach provides comprehensive relief from symptoms and has shown sustained efficacy in clinical trials. However, the need for subcutaneous injections may be a factor to consider. On the other hand, Eucrisa is a convenient topical treatment that is suitable for individuals with mild to moderate atopic dermatitis. Its localized application minimizes the risk of systemic side effects, making it a safe option for long-term use. Eucrisa is easy to use and does not require injections, which may be preferred by some individuals. Ultimately, the choice between Dupixent and Eucrisa should be made in consultation with a healthcare professional. They can evaluate the individual's condition, medical history, and treatment goals to determine the most appropriate option. Conclusion and final thoughts on Dupixent versus Eucrisa for atopic dermatitis treatment. In conclusion, Dupixent and Eucrisa are two effective biological therapies for the treatment of atopic dermatitis. They offer hope for individuals struggling with the symptoms of this chronic inflammatory skin condition. Dupixent targets specific proteins in the immune system, providing comprehensive relief from symptoms and improving the overall condition of the skin. Eucrisa, on the other hand, acts locally to reduce inflammation and control itching. Both treatments have shown significant efficacy and safety in clinical trials, with patients experiencing improvements in itching, redness, and overall disease severity. The choice between Dupixent and Eucrisa depends on various factors, including the severity of the condition and individual preferences. It is important to consult a healthcare professional to determine the most appropriate treatment option for atopic dermatitis. They can assess the individual's condition, medical history, and treatment goals to guide the decision-making process. With the availability of Dupixent and Eucrisa, individuals with atopic dermatitis now have more options for managing their condition. These biological therapies represent a significant advancement in the treatment of atopic dermatitis and offer hope for a better quality of life.